there, thanks for watching so far. I'm just going to go through the question and answer section. So I've got a few pre-submitted questions which I'll answer, and then I'll pass over to Marie, who's going to answer some other questions. So first question we've got is from Caroline, and she's asked what are the common signs of diabetes. So hopefully this presentation has already answered your questions, Caroline, but just to recap, so the most common symptoms of diabetes are probably feeling thirsty. So are you getting up in the night drinking loads of water? Other thing is passing a lot of urine, so you're having to start getting up for a wee 3 or 4 times in the night, or you drinking gallons of water. Sometimes you can get a bit blurred vision as well, and also you can feel a bit tired. Now obviously you can feel tired anyway because you're busy at work or whatever, so that's not always a sign. So what would you do if you had those symptoms? So probably the first port of call is to ring your GP practice and book a blood test, and then that will tell you if you have got diabetes, and then they would book you in with the diabetic nurse to explain to you what the next steps are. So the next question we have is from Avril Ray, and she was wondering, like, her blood tests have been borderline every time she's checked them. So she's not a big person, she's trying everything she can personally, but every time she comes for a blood test it's still borderline. She's wondering, how can she change this, what can she do? So Avril Ray, I mean, first thing to say is that you've done really well, it hasn't gone up, so you're doing something right. Main thing that you could probably do is look at your diet. So it doesn't sound like you're overweight, but maybe you're eating too many carbohydrates. You could look at a low carbohydrate diet. It's worth looking, there's some good books that you can look at. There's Michael Mosley's Blood Sugar Diet. There's also, if you're on Twitter, you could follow Dr. David Unwin. He's a GP in Southport, and he's got the lowest prescribing of diabetes drugs in the Northwest because he's put all his patients on the low carbohydrate diet, and it is possible to reverse diabetes. So I would say don't give up, keep trying, and take some advice from the diabetes specialist nurse in your practice. Do some reading and hopefully you'll have success. Okay, thank you.